Hi everyone, welcome to researchmd.com. Today we're going to teach you all about interpretation bias. Again, my name is Pramil Cheriyath. I'm a physician, I'm a director of research, and I also teach internal medicine residents and the medical students, and I'm also assistant professor of medicine at two major universities. So let's get into our subject. Today we're going to talk about all about interpretation bias. Okay. Interpretation bias, if you look at a definition, is an information processing bias with the tendency to inappropriately analyze ambiguous stimuli, scenario, and events. That's the definition, right? So there's four types we're going to talk about it today. One is confounding, the other one is effect modification, and the third is lead time bias, and the other one is the length time bias. So we're going to, each one of those we're going to go and give you an example. So what is confounding? Definition of confounding: a systematic distortion in the measure of association between exposure and the health outcome caused by mixing the effect of the exposure or primary interest with extraneous risk factor. So what is an example of this? I mean, the other thing, confounding is associated with the outcome and exposure. Okay, so I'm going to, let's say lung cancer and smoking. The smoking is the exposure, lung cancer is the outcome. So in confounder, both lung cancer is going to be affecting the lung cancer. It can also affect the smoking also. So and in the confounder in this study is going to be alcohol use. So what happens when people drink or they go to the bar, they're exposed to smoke, right? So alcohol is a confounder in this, can affect the outcome. So think about lung cancer, smoking, and alcohol is a confounder. Okay. The next one is the effect modification. Look at the first. We're going to look at the definition. Effect modification is all about stratification and occurs when an exposure has different effect among the different subgroups. Effect modification is assured with the outcome but not with the exposure. Remember that. In the confounding, both of them were affected, right? The outcome and the exposure. But in the effect modification, only the outcome is associated with the outcome, not the exposure. Remember that point. So let's look at a study. I mean, I'm going to say like cardiovascular study. They looked at the cardiovascular effect on the population, and they chose the people less than 50. Okay. So what happened to the less than 50 people? Like, they don't usually have much cardiovascular disease, right? They should have, the population should be chosen maybe like 60 to 70 or 70 above, where cardiovascular disease is very common. It's an example of the effect modification. Okay. The third one is the lead time bias. Early detection interpreted as an increase in the survival, but the disease course has not changed. Same thing. You got the cervical cancer, right? You got a long period before, for survival, right? So cervical cancer diagnosed by early pap smear may appear to exaggerate survival time because the patient are known to have cancer for a very long time. Okay, that's what lead time bias is. What is length time bias? So screening test detects disease with a long latency period, while those with a shorter latency period become symptomatic earlier. So thinking like, some of the diseases can have an outcome like really, they may die, like a pancreatic cancer, maybe people will die in 1 year, right? Some of the cancer can be like a very long time. So slowly progressive cancer is more likely detected by the screening test than a rapidly progressive disease, okay? Again, thank you so much for watching. Please subscribe to our channel. We'll be back with another presentation soon. Thank you.